Tell me. You can sit and tell. No need to stand. What do you mean by vital signs? What do you mean by vital signs in clinical examination? You can sit and tell, but you have to be loud. Everybody has to hear. I have to hear. So be loud, and whatever you are telling, say loudly and confidently. I just heard some words, skin, nails, like this. Just be loud. Okay, roll 52. Do you want to modify this or change this answer? Pulse pressure. Pulse pressure. What do you mean by pulse pressure? What are you talking about? Pulse pressure means? BP is? What is the full form of BP? Blood pressure. And what is pulse pressure? Yes. Do you know that clinically? Systolic, the difference between systolic blood pressure and diastolic blood pressure is called pulse pressure. Do you note that clinically? The question is, what are the vital signs on clinical examination? So you are telling blood pressure. Then what did you tell? After BP, temperature. Then you told pulse pressure. Pulse pressure is the difference between systolic blood pressure and diastolic blood pressure. So if we note blood pressure, we can just subtract diastolic from systolic, and that we get the value of pulse pressure. So is it a mathematical? Okay, mathematical, but do we note it clinically? We note blood pressure. That is, if we note blood pressure, we can just calculate pulse pressure. So except blood pressure and temperature, respiratory rate, and not pulse pressure but pulse rate itself, pulse rate, rhythm, volume, these things. Okay, roll 53 absent, roll 54 absent, roll 55 is also absent, roll 56. Yes, so these vital signs are a part of what part of our clinical examination? Is it all over general examination or systemic examination? All over general examination. So can you tell me some other points except these vital signs which we do note in general physical examination? This is about the patient particulars. Okay.
Then surgery history.
Okay. Roll 57. Who is roll 57? 57 is absent. Roll 57. Okay, maybe I did not note down. Absent. 58. Okay. Could you hear what she said? Did you hear? Okay, you sit. Did you hear what she said? Okay, I am repeating it. I just heard that she is telling that general physical examination, except the vital signs are a part of general physical examination. Except the vital signs, we are to note the patient particulars. Then she was talking about history taking. Okay. So do you want to that if there is pain, she told if there is pain, we have to ask the duration of pain, any past illness, any history of any surgery, these things she was telling. So do you want to modify this answer about general physical examination? Except the vital signs which she told. Roll 52. Your roll 52. Do you want to modify this answer on general physical examination? Pulse, blood pressure, respiratory rate, temperature are vital signs and are a part of general physical examination. What others? These signs, plus she was talking about history taking, although this is not, I asked you general physical examination, not about history taking. Okay. These, you are roll 58. So there are no other components in general physical examination. That's wrong. Roll 59. Do you know? What are the other points to note? Eyes cyanosis dekhe na, anyway. We have to note the different parts of the body. It is better to do from head to toe. Yes, in eyes, what do we note for? In the eyes? That is called jaundice. Yes, and পরীক্ষায় তো ওরম বললে হবে না, নিচে টেনে করে, what is that called? Paleness. Yes, we note for paleness and that is called medically কি বলে? Like yellowish discoloration is called jaundice. Pale color is medically termed. The word comes from pale itself. pallor, and we note it. Don't tell it like that niche tene. We note it in the which part of the eye by just removing that. Okay, don't answer out of turn. Lower palpebral conjunctiva, and we note for jaundice in sclera and the upper bulbar conjunctiva, and except the eyes, cyanosis at the tips of mucous membrane. Cyanosis. Cyanosis is what type of? It is again one type of change in color. What change? Bluish discoloration. Why does it? Sorry. Cyanosis is bluish discoloration. Okay, you told about eyes. Either tell the try to answer like when you will, if you are asked like this in general physical examination, what do we note? Then either answer like the points. We see these points. These are the vital signs. These are the or you have to say head to toe. So if you say eyes, then you have to mention in eyes we see this, in lips we see this. As professionals, you will do it from head to toe, right? But in the first year, if you answer just like this, you have to note the pulse, you have to note the blood pressure, respiration, temperature, then pallor, cyanosis, jaundice. It's okay. Okay, your roll number? 59. Roll 60 is absent. Roll 61. Yes. Any other points? Ictera, cyanosis, he has mentioned. Clubbing. Clubbing, where do we note them? What do you mean by clubbing? Yes, Loviband angle, that's the name, but what is the angle between what? What is this angle is called if you describe it in say physical terms in the in your that is there is a diamond shaped sign, you know everything. The angle name is onychodermal angle between that skin and the dermis is for skin and onycho is for nail, so that what, so we can note it by noting the diamond shape, or as beginners you may say it is better to note by putting the not better, I will say that it is convenient. So to note the from the side by putting. Yes, you can say about the diamond shape, whether the diamond shape is persisting or not. So that is clubbing. Clubbing is associated sometimes with some respiratory diseases. Yes, and what else except clubbing? Edema is, what is edema? Fluid accumulation where? We usually check in the legs. Which part of the leg? Just when you answer, you just answer. When the examiner will ask you, don't show your leg, just answer. Yes, just above the medial malleolus. That is not in the foot, in the leg, which we medically call the leg. Medically, the parts of the lower limb are thigh, leg and foot. So in the leg, just few centimeters maybe above the medial malleolus, we note it by pressing it for few seconds, several seconds, and then noting it when the swelling goes away. So that is how to note edema, and this is pedal edema. Edema can be in other, so it is the accumulation of fluid, but we can't say in the leg which part. So we can't, we have to be more accurate in this. That means leg, this is not only in the legs, it can occur in other, it is in primary, in the beginning it can be noted, like in the jaundice, when the jaundice is just yellowish tinge is coming, just bilirubin is just increasing. If bilirubin is say 15-20, then it will be all over the body, it can be noted very obviously. But just when the yellowish tinge is coming, it can be perhaps better noted, maybe the under surface of the tongue or this whitish part. The yellowish part will, still the skin is not so yellowish, but the whitish sclera is yellowish. Likewise, edema is first noted, pedal edema, sacral edema, but it is actually the accumulation of fluid where? In tissue. Tissue, is it tissue? The word is tissue spaces or interstitial spaces, and except edema, clubbing edema, pallor, cyanosis, jaundice, clubbing edema, and 1 or 2 points are left, neck veins and neck glands, that is lymph nodes. And what everybody missed is, as soon as the subject is, we see the subject, we have to get an idea about the general build and nutrition. That is a part of general physical examination. Okay, roll your roll. Okay, roll 62. Okay, you tell me what do you mean by percussion?
Sir, percussion means to tap.
Percussion, the word percussion means to tap. In till now, whatever we have discussed in clinical physiology, how is it relevant? What do we use percussion for?
Sir, in the checking of respiratory rate between the intercostal space, in the intercostal spaces, we have to do percussion to feel the tap.
Is it about respiratory rate? Respiratory rate, does it require percussion?
No, sir, not the respiratory rate, but the respiratory examination step.
So, what do you note by percussion? So, percussion is not about respiratory. Respiratory is counting. For counting the respiratory rate, you don't need percussion. So, what do you need percussion? What we are noting actually? Respiratory examination, but what will be the what finding or for what purpose we are doing this? When we are percussing, what we are noting?
Sir, the sounds that are coming by tapping.
Coming by tapping, so that sound is coming from where? So, like if you percuss on a tank, say full of water, and if you percuss on an empty tank, then the sounds will be different.
Yes, sir.
So, you are percussing over the chest, so what organs are there?
Sir, the lungs.
Lungs, and also what organs are there in the chest cavity?
Sir, heart.
Heart. So, there will be some kind of note when there will be air in the lungs, you are percussing over some part where there is air.
Yes, sir.
And if it is a organ, say solid organ like the heart or the liver is overlapping the lungs, or you percuss somewhere and you go to the diaphragm, so what type of, there will be another type of sound. So it is differentiated, sounds are differentiated, like what their sounds are called, we call them, how we describe them. Lung sounds, air filled lung sounds are called what type of sounds? Okay, so we have to note the sounds by rule 63. So air when we do percussion, sounds coming from air filled lungs, they are described as what type of sound? Resonance or resonating sound. And if it over an organ, it is no, not tympanic. Tympanic is again, tympanic or resonance is almost. So others don't answer out of turn. So we'll see from resonating it comes. So whenever we are percussing, say in one region, and we are passing over to another region where some organ is overlapping the lungs, the the air filled lungs, where the lungs, there are the alveoli, the air sacs in the lungs. So that type of sound is called dull sound, dullness. So from resonance to dullness. Okay, your roll number 63. Okay, roll 64. So we are talking about resonating sounds and dull sound. So whenever there will be organ, we are percussing over organ, perhaps there will be dull sound. So one organ already mentioned is the heart. So when we percuss, say from the, what are the regions where we percuss, or we not only percuss, we put the stethoscope on over for hearing sounds from the chest. What are the regions, or we put the stethoscope on? You have to say, name the, we cannot say like that. Like some people are writing in answer scripts thalassemia, definition of thalassemia, or what is thalassemia? Thalassemia is a disease. It is actually a stupid answer. Thalassemia is a disease. If it was a question in the say second standard, third standard you were studying in school, what is thalassemia? Thalassemia is the name of a disease. That holds some meaning. But here you have to write about the disease. Like that, you can't, it is not very intelligent like the answer to say it is heart. So you have to say some areas. We know of some areas over the chest from where we put the stethoscope on and try to hear the sounds. What are the areas? Stethoscope, or with the hand we try to feel the vibrations. We try to feel some other points which we'll just discuss. So we either feel or put the stethoscope. What is putting? We put the stethoscope and hear something. So what is that method of examination called? Using the stethoscope? No, percussion is tapping, auscultation. So what are the areas over which we auscultate during What do you mean by palpation? So see you yourself, not only you and others also see the condition. If we just go there, you will just 5 or 6 people will make a group, do something, some people will learn, some people will just stand and see and go away. And you don't know basic things which you have to know theoretically before. Obviously clinical is, that means before performing. Obviously clinical physiology is about performing, not answering. But you have to know the basic things, what I am doing, why I am doing, what is my aim. So classes have been taken on general physical examination, pulse, blood pressure separately, respiratory system separately, cardiovascular system separately, examination. So if you can't answer what is palpation, then it is very difficult. What is inspection? Your role? What is inspection? The whole of general examination is inspection? No, not that. Role 65? Yes, what do you mean by inspection? Does the word inspection mean that identify shape of chest we can use palpation also? What are the meanings of this term? Inspection means without touching. That means just by observing whatever we note. Like what is a point in general physical examination which we are doing just by inspection without touching? You don't need to memorize. Whatever we discuss, just listen. What did we discuss? As soon as we just look at the subject. Can you note for clubbing just by inspection? Yes, theoretically maybe by asking the subject properly to do that make the hands. But usually we touch the subject and help the subject how to put the hands like this. So just by inspection, not pulse, not blood pressure, you need to use instruments also and hold the subject. Any 1 or 2 points just by inspection. Don't try to memorize, try to just understand and answer. You don't need to touch the subject. For which parts? What? Just the points were discussed. For Palor you have to touch, for noting Palor. For Jaundice you have to note some eyes, nail beds, okay. Okay, in the respiratory system, what do you note by inspection? Chest what? What? Only shape? Rule 66. Okay, what do you note by inspection in general physical examination? Respiratory rate, right. For respiratory rate, we do not need to actually feel the pain. What we do, how do we measure the respiratory rate? What is the method? We don't tell, we just hold the pulse. We just hold the pulse so that the subject will be thinking that we should not. Okay, the subject is thinking that as if the pulse rate is being measured, but actually we count the respiratory rate. But if the subject does not get anxious, it is better to do it from the foot end. That is about the respiratory rate. And what else in general physical examination as well as respiratory system, except the respiratory rate?
We check for any symmetry of the
shape and symmetry of the chest, we try to get an idea. And what else?
check for any scar or swelling marks.
Obvious scar mark, swelling mark when we inspect the chest. And not only the respiratory system, just over the chest inspection, we are inspecting the chest area. So swelling, scar mark, shape and symmetry of the chest, and any other just above the chest, anything, position of the trachea, and except scar marks also some, whether the veins are engorged or not. Your roll 60. Okay, roll 67. Okay, what is apex beat? Okay, if not apex beat, you tell me the areas over which we put the stethoscope for hearing the sounds? Interscapular. So what you put the stethoscope for hearing what? Yes, what sounds are they? Sound of breathing. They are called breath sounds. Breath sounds. How many types of breath sounds are there? What are the? We put over suprascapular axillary region. So sounds are coming from the lungs. In a normal healthy person, this lung alveoli, air-filled lungs. So that type of breath sound, what is called, and it is different from the sounds coming over the trachea or the large. We cannot put the stethoscope directly over, we cannot locate like that the bronchus, but we can feel it over the trachea. So these sounds are different, sounds coming from the trachea, those breath sounds, and breath sounds coming from the lungs, air-filled sacs. So what is the difference, or at least name? Your roll 67. Roll 68. Okay, can you name? Yes. Yes, bronchial breath sounds are coming in from which part? Clinically, we can feel over the lungs or the trachea. And then vesicular. Okay. You tell what is apex beat? So don't try to memorize again. Is beat a sound? Apex beat. Like pulse beat, do we feel or hear with the stethoscope? Is it a sound or just feeling? Pulse beat, we hear over the, so it would be. So apex beat is not a sound. So you just told in the fifth intercostal space when we hear a sound. This is the difference. Difference means this is the, your approach is wrong. Maybe you know what to do, but your approach is wrong when you answer. That is, apex beat is not a sound. So it is not, maybe in the fifth intercostal space, and that is also not the definition of apex beat. That is how you are doing it. What is apex beat? Why are you talking among yourselves? Yes. Don't talk among yourselves now. So there should be a definition, or what do you mean by apex beat, and then comes how do we perform it. Clinically, how do we show it? So roll 69. Can you name the areas? Areas like he told, suprascapular, for hearing the breath sounds. For hearing the heart sounds, what are the areas? Okay, if in the fifth intercostal space, what is the name of that area? Like there is suprascapular, infrascapular, supraclavicular, inframammary, whatever, axillary, in case of hearing breath sounds. For hearing the heart sounds, what are the names of the areas? What is the area in the fifth intercostal space? Name of the area? You tell me the name of the valves of the heart present in the heart. Valves present in the heart. Bicuspid, tricuspid, and semilunar. So they are located somewhere. Where is the bicuspid? Bicuspid valve is also called the another name? Mitral valve. So where is it located? Between left atrium and left ventricle. So there is an area which is, these areas are named, there are at least two areas named according to the name of the valve. So that area which you are speaking of, fifth intercostal space, there is an area called the mitral area. Likewise, there is another area named after a valve. Which area is that? So examiners will try to give you hints also, but even after that, if you don't answer, okay, roll 70. Okay, what are the names of the areas? One is mitral, others are?
The second is tricuspid area.
Tricuspid area, it is, yes, tricuspid, because tricuspid valve lies between the right atrium and the right ventricle. And others?
Pulmonary area and aortic area.
Pulmonary area and aortic area, okay. Roll 71. Yes. Can you tell the mitral area is in the fifth intercostal space? Left or right? Left side. Left side. Tricuspid area, which intercostal space? Which level? Fifth, sixth, seventh, or something else? Mitral is left fifth. Tricuspid? It is fifth. And left side or right side? right side, okay. Aortic area, which level? Second, third, fourth, fifth, sixth? Second intercostal space. And pulmonary? It is also on the second. So mitral and tricuspid are fifth, aortic and pulmonary are second. Now it comes to left, right. So mitral is surely in left, aortic is in?
It is in right side.
Okay. Although aorta is arising from the left ventricle, it is on the right second intercostal space, because the heart is, it is not two-dimensional, it is three-dimensional, and it is arranged in such a way that these areas fall in the right, on the right side. Okay, right second intercostal space, it goes behind the sternum. And pulmonary area, second intercostal space, right or left?
Pulmonary is on left side.
So this is somewhat, it may appear some that how is it happening? Pulmonary is actually from the right ventricle, but it is so. The heart is so arranged, it is a three-dimensional structure, it is so that the aortic area is from the right second intercostal space, pulmonary area left second, and the great vessels cross over. You know this better than me, because you are just have seen maybe 1 month ago specimen of the heart, how the vessels are lying. So aortic area is it is arising from the left ventricle and going like this, crossing over the pulmonary artery. But the pulmonary valves, the semilunar valves, the origin of the pulmonary artery is in the left side. That means this is, we are speaking in terms of the chest cavity. On which side? Intercostal spaces means the right side of the chest cavity, right intercostal spaces, left side. What is the chest cavity called? From your knowledge of anatomy? Your roll 70? Roll 72 is absent. 72 absent, 73? You are 73. Yes. So tricuspid area she told in the right second, or that is wrong, left second. Okay. There, left fifth, sorry. Fifth intercostals, both are on the left, but it is okay. So how do you, so we are talking about intercostal spaces. We have to locate these areas. Maybe the apex bit definition is still to be okay. So these areas, so how do you locate these intercostal spaces? So you are showing it. So when you are being asked, you just tell, although you are showing it, if you are showing it, so you are showing the second rib over the sternum. That's not possible. From the suprasternal notch, which direction you have to go to find the second rib? Okay, downwards, but you will not find the rib over the sternum. So for the rib, you have to go either right or left. Then, okay, if you find the second rib, then so where is the second intercostal space? Again, how can a space be on the sternal angle? Space will be gap between one rib and other rib. So second intercostal space is above the second rib or second and third. That is, the intercostal spaces are named, that is the space below the rib, corresponding rib, the space below it is of the same name. Between the first and second is first intercostal space. Okay. Which rib lies behind the clavicle? You might have seen in anatomy X-rays. It lies behind the clavicle. Okay. We can locate like that also. So we can go behind the, that means we cannot go behind the clavicle with clinically, but it is behind the clavicle. So the below that is first intercostal, then the rib below that is second rib, below that is second intercostal space. So we have to start from second intercostal space. Otherwise, we have to locate the other intercostal spaces. We just can't go arbitrarily. So that is about the how to locate the intercostal spaces. So in which intercostal spaces when we percuss, so we are percussing for the breath sounds. How do we do it? We percuss the second intercostal space, say of the left side, like noting it like this. So immediately after that, what do you do?
Then we come to the right side.
Right side. So the rule is after that we go to left third, right third, like this. Okay, good. 73. Roll 73. Roll 74. Yes. What is the definition of apex beat?
I think it is a contraction of the left ventricle.
Apex beat is contraction of the left ventricle. So all of you, I did not tell you to close your books. Okay, you have opened your book. Still, you are saying apex beat is contraction of the left ventricle. Apex beat is what? Contraction of left ventricle is ventricular systole. But what is apex beat? What does the word apex mean here? Lower end of the heart. Okay. Okay. What do you mean by vocal fremitus? Vocal fremitus. Sounds of the heart. Then situation is very poor. Roll 74. Roll 75. Yes. What is vocal fremitus? Vocal resonance. Do you know these terms? Yes. This is again how to do it. So what is vocal fremitus? The vibrations felt by palpation. When we, so this is, you are describing the method. The vibrations felt by palpation or felt by palpation or felt by touching over the intercostal spaces when the subject is asked to, yes, like this, that is vocal fremitus. And what is vocal resonance? No, that is resonating lung sounds by percussion, and vocal resonance is just the auscultatory counterpart of vocal fremitus. That is, we are placing the stethoscope and hearing 111 and we are listening directly, and for vocal fremitus that is listening to the sorry, not listening, that is feeling the vibrations, and vocal fremitus is noting these sounds. So feeling vibration, noting sounds. Okay, roll 76 is absent. Okay, roll 77. You. So in the respiratory system, or when we are talking about this respiratory system examination, we are speaking of vocal fremitus and vocal resonance. Okay, so one is by palpation, one is by auscultation. When you examine the cardiovascular system, similarly, can you tell something which we can note both by palpation and by auscultation? Same things, the names are different. Same things we note, but names are different. We note some sounds by auscultation, and we can also feel it by just by palpation without using the stethoscope. Feel it to some extent. What is that thing called? Sounds by auscultation, which we can feel by palpation as well. I am just giving you a hint. These are not the normal heart sounds. These are the abnormal, some type of abnormal heart sound. Soft abnormal heart sound. Okay, what are the normal heart sounds? Which are heart sounds which are produced normally physiologically? Physiologically, what heart sounds are produced? You have read about the cardiac cycle. It was a part of this exam. Did you appear for the exam? It was a part of the exam syllabus. 78? Yes. What is that soft abnormal heart sound called? That is, the question is that the heart sound which can be, sounds can't be picked up by palpation obviously, but those types of, say, a vibration or a feeling can be picked up. Like in respiratory system, we talked of vocal fremitus, vocal resonance. The same thing, but we are picking up by the hand or by the stethoscope. Here also same thing. Either by the hand, it is by palpation, by the stethoscope, it is by auscultation. So as he was not being able to answer, we just, the hint is that by how do we, that is, it is a soft sound, that is, it is a soft sound picked up by the stethoscope. Yes, but are those so don't say like lapped up, it is sounds like lapped up. What are the names? How do we name them? Normal heart sounds? S3 and S4 as you are telling. So also there are S1 and S2. That is first heart sound, second heart sound, third heart sound, fourth heart sound. Like some soft heart sounds, except these there are which are abnormal sounds occurring due to some diseases. They are called, okay, if you, as you couldn't answer this, you tell me that what is there to left in, there can be many things that can be asked, what do we note on. So, can you tell me some abnormal shapes of the respiratory system? We talk of some abnormal shapes in some diseases. It is written in your books that on inspection, if we find the shape and size symmetry or confirm it by palpation, like there is some shape called pigeon shaped chest. In which disease does it occur? Rickets. Rickets in the children. That is, it occurs due to that. In some questions will be there in clinical physiology which will just come by discussion, and the examiner may ask you rickets, very easy to answer it this level. Rickets occurs due to what? Vitamin D deficiency in children. Okay. 79 is absent, 80 is absent, 81. Yes. Tell me the parts of a stethoscope.
Sir, there is rubber tube, iris, diaphragm, and ear tubes.
Iris, is there any part of the stethoscope? Which part of the stethoscope you are calling iris? Okay, you are trying to show the stethoscope, okay. So first, what are the rubber tube, diaphragm, and iris, and ear?
Earbuds.
No, they are not called earbuds. They are called earpiece. And the part we are putting in the ear is called the earpieces, 2 earpieces. Part we are putting on the, so where do we put the stethoscope? This part to hear the sounds, that part, where do we put it? Over the, where we are putting the chest? No, ear we are putting the earpieces. So we are putting the other part, chest, don't prompt. So chest, we are putting over the chest or maybe over the abdomen also. To hear some sounds, we will do clinical examination of the abdomen next week. So abdomen or the chest, but it is not called the abdomen piece, it is called the chest piece. Now the parts of the chest piece are those. So maybe some books are written iris, diaphragm, or the wider, broader part is called the diaphragm. And the opposite part of the, so chest piece has 2 parts, the broader part and this narrower part, which what is called, should not be called narrower, roundish. So the diaphragm of the chest piece and the, which you just pointed calling the iris, that is not the iris, the diaphragm or the iris diaphragm. Yes, that part is called, that is the diaphragm, and that, this one, no, that has some other name. So we pick up soft sounds like which you are speaking of with that. That is called bell of the stethoscope, right? Roll number 80, 81. So roll 82, you. With the bell of the stethoscope, what sounds do we hear? What sounds are better heard with the bell of the stethoscope? Like, yes, soft sounds. You have still not named the soft sound, that heart sound. Or other sounds, classically some other sound except heart sounds are told that we pick up better with the bell of the stethoscope. Then, sorry, other than this adult heart sounds, what heart sounds? Pediatric, it is not called pediatric, not children. So it is when the child is within the, or the fetus is within the mother's womb. Fetal heart sounds are better picked up with the bell of the stethoscope. What is, so when do you note blood pressure? What are the methods to note blood pressure? What methods do you use? What are the names of the methods? What is the instrument used for measuring blood pressure called? Sphygmomanometer. Okay. Roll 83 is absent, roll 84 is absent. 83 and 84 absent. Roll 85. Who is 85? Yes, what are the methods we use? Names of the methods you use to determine blood pressure, recording blood pressure? Palpatory method. Which is it mandatory to do palpatory and auscultatory together, or you can use any one method? Just answer, is it mandatory to do both palpatory and auscultatory each time we measure blood pressure, or is it just anyone can do? So you have to do both. So which is first? Palpatory method first, without using the stethoscope. For palpatory method, which artery do we that means which artery we have to locate, and for the palpatory method of blood pressure we have to choose which artery? Radial artery. For the auscultatory method, so that is another artery of the superior extremity. Brachial artery. Role 86, yes. How do you locate the brachial artery? For any purpose, maybe for clinically for measuring the blood pressure, auscultatory method, how to locate the brachial artery clinically? We have to place the stethoscope over the brachial artery, but before that we have to locate it. If we instead of the brachial artery, instead of placing over the artery, if we place on some say other structure, then we can't hear the sounds. So we have to put over the artery. So how to locate that? Like radial artery, we locate before locating, especially in obese person, we have to do some maneuver so that it can be located. We measure the pulse rate. So brachial artery, how do we locate? From the biceps brachii, that is the name of a biceps brachii is name of a muscle. So will that lead to the artery? If we come from the biceps brachii, say you can feel the biceps brachii and come. So it will maybe end, or it will lead to some muscle, or it will lead to some bony attachment, tendon, etc. But how to locate the artery? Even if it can be done. Are you doing surface marking in anatomy in each of the sections? Superior extremity, inferior extremity, thorax, abdomen, are you doing surface anatomy? So you should tell better than me. Is it possible to locate the brachial artery by just surface anatomy? Some things are possible, I don't know, that I have forgotten. Is it possible to locate just surface anatomy, noting something? If not, then we have to locate somehow for. Okay, tell me, what do you note in, so when you are meeting clinically a subject, what clinically a subject you are examining, an individual. So during history taking, what is this term family history? What is it about, family history? Disease present in that person. So can you, as soon as you start examining a subject, can you identify whether the disease is present in a subject, especially this which is present in the family? So you just take the note, if any disease is present, not present, whatever he or she is complaining of, what do you ask the subject about family history? That family history of diseases, any disease is present in the, that is which is hereditary, whether he or she does know of it or not. That is what is to ask, that whether there is a history of diabetes or hypertension, these non-communicable diseases in your family. These are not communicated from one person to another. Not that if I have caught a common cold and if I sneeze here, then you may catch the respiratory disease, another person may catch it, but not diabetes or hypertension. So you have to ask that whether there is any history of such disease in the family. What do we pick up in, or what do we ask about in personal history? That is just description of present illness. That is the illness which is the symptoms he has brought. So personal history is something else. Role 87. In personal history, what do we ask of? that is history of past illness. But personal history is about some personal habits. What are those? Okay, maybe about food habits, hygiene, these things should be asked also. But also about, okay, tell me what is the duration of a cardiac cycle, normal cardiac cycle? 0.8 second. So out of that, how do we divide it, or how is it just classified? 0.8 second, so much is for this 0.5 or right. You are roll 87, roll 88 is absent, roll 89. So can you say that how to locate the brachial artery clinically? First, what we have to ask the subject to do, or what will you do? Okay, for examining the chest, the respiratory, these breathing patterns, respiratory rate, etc. What part of the body do you have to expose? From which part of the body?
The chest part.
And only the chest part. That only the chest part means where to where? How do you? So which parts may be covered and which part has to be exposed?
The carotid artery and
Don't try to memorize again, or just what are you talking about? You yourself don't know. How do you note breathing movements in the carotid artery? Can we see the carotid artery from outside? You are clinically noting something, clinical examination. So how does the carotid artery come here? Carotid artery is a structure inside the body. How do you note it with your eyes? Maybe some veins can be noted from outside. Can you see any artery from outside? So it is a stupid answer to make. Just think and answer. Even if you can't answer, don't answer stupid things. Where is the carotid artery located?
carotid artery is located in the neck.
In the neck. So what structure where have you read about this carotid artery in cardiovascular system? Where have you read this? In which context? In cardiovascular physiology? What is present there at the bifurcation of the carotid arteries?
In the examination of respiratory
No, again.
feet.
How is apex beat related to the carotid artery? Roll 90. Yes. Can you define the apex beat? Like which nobody, 2 or 3 people were asked. Can you define the apex beat? Lowest and so that is not the definition of apex beat. Downmost and outmost portion of not the chest, of the chest wall, of the precordium. Then where? No, heart sound. We are not hearing sounds in apex beat. We are feeling for the pulsation, where a definite pulsation can be felt. Right? Okay, then tell me. Okay, tell me what is cardiac output? Okay, roll 91. Yes. Can you name some contractile proteins in muscles? Are there any other? What is the contractile unit of a muscle called? Any skeletal muscle? Name some skeletal muscles which is helping in breathing. Although respiratory system has not been discussed, but this should be, you have read about it in anatomy. Names of these inspiratory, expiratory muscles. It is related to these, we are speaking of intercostal spaces, hips, so it is related to these. A very large inspiratory muscle, large size muscle, inspiratory muscle. So these things, even you don't have to crack NEET and come here for answering these things. Rule 92. So can you name other proteins other than actin, myosin, contractile proteins? Which element, ionic form of which element helps in muscle contraction? It is very associated with muscle contraction. Calcium. Can you tell that ionic form, any other use or any other utility of calcium in ions in the body? Others don't prompt. Action potential is there, okay, maybe some role, but is there any, what ions do you mention of in action potential? This, as you told of action potential, so during your whatever examination, say clinical, hematology, viva, when you are being asked questions, don't answer such things which will lead to other things. Those might get difficult for you. Still easy things. What do you talk? Which ions do you talk of in action potential? That is not calcium. Others don't answer when it is others' turn. Your roll number? Roll 93 is absent. Roll 94. What is the difference between sign and symptom? And then what are symptoms?
Symptoms, what the patient complains about.
So instead of the patient, we should say the individual or the subject complains about. So can you just give examples and explain this?
Then cough.
Yes, cough is a symptom. Okay. Then example of, another example of symptom. Pain, cough, fever, headache, whatever the subject complains of, that I am suffering from this issue, I am having this issue. And sign?
We check the temperatures of the individual.
Yes. So if fever is the symptom, then measurement of temperature. Temperature is the sign. If pain is the symptom, what is the corresponding sign? How is it called? We are feeling for the, that is called tenderness. Okay. Now roll 94. Roll 95. Yes. He was talking of the action potential. Calcium is not, that means it is not very much relevant with that. So what is that? What are the phases of action potential? Myosin binding site of acting, what are you talking about here? When does this binding site, myosin and actin?
So when the calcium binds to protein,
So what are you speaking about? Is this the action potential or something else? Myosin actin binding happens when? During What physiological event? Is it action potential or something else? Muscle contraction. Then what is action potential? We are not talking about muscle contraction. So is action potential about muscle cell?
Sodium ion enters into
Rule 96 and 97 are absent. Rule 98. Again 99 is absent. Okay, so rule 98. What are the ions which are primarily involved in this action potential? Sodium ion and potassium ion. So what are the phases? Yes, polarization states. So the phases are named according to the polarization state. So there are the names of the phases. Depolarization, repolarization. So what occurs first? Depolarization followed by repolarization and after hyperpolarization. So what is the resting membrane potential from which it is rising towards depolarization? It starts from, what is the value?
70 millivolt and depolarization plus 35 millivolt.
So it is starting from 70 millivolt and it is decreasing to 35. That is what you are saying. So it, yes, minus 70 millivolt, and it is then actually not decreasing. It is towards going towards plus 35 millivolt. So it is about, we are speaking of what cell here? Is resting membrane potential same in all cells? So what is the difference? It is not the same in all cells. Then, okay, can you name a muscle for inspiration? We are talking of in the respiratory system these things, these intercostal spaces, how to note about percussion. So what is during taking deep breath? So what muscle is helping it? Or performing that inspiration? Diaphragm. Diaphragm is the, so mainly the central tendon of the diaphragm, it goes downwards during inspiration. And other muscles are the intercostal muscles. We'll discuss, this will be discussed in the theoretical part. Why that person needs to take deep breaths when we see the breath sounds, we are noting the breath sounds, we ask the person, take deep breaths. Okay, rule 98. Rule 100. So while percussing the chest, how do we locate the borders of the heart? During percussion. Percussion means tapping. Again, we note from the resonating areas, the dull areas will indicate the organs. The resonating areas over the fluid, not fluid field, air field, lungs, resonating sounds. So how do we locate for the or try to locate the borders of the heart? And can we locate them? Yes, which border of the heart can you locate? How many borders are there? Again, you have done anatomy also. So what are the borders of the heart? You will tell better than me. You have seen the specimens. So how can we locate them clinically? Are we able to locate all the borders of the heart? Is it possible to locate clinically? No. Then which border of the heart can be located? Left can be located. Yes. How? So how do we approach them? Can we just put our hand in the fifth intercostal space? Firstly, you have to start from the second intercostal. Otherwise, how will you know it is fourth or fifth? So starting from second. So directly we go for the border or do something else? Okay, tell me what are the parts of the stomach? Have you done abdomen in anatomy? But parts of the stomach you should tell from even from your knowledge of this GI physiology, digestion, parts of a stomach. Parts of a stomach, you can't say parts of the small intestine? Large? Yes, what are the parts? So the point is that try to note yourselves, you are just, when you are appearing for your viva or clinical or hematology, whatever, you are either on your own or in a group of 6 or 7. Here you are a group of almost, say, out of 50, maybe how many? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, maybe 40, 35, 40 are present. So try to judge what is your own position, and you have to leave about, even if you leave these internal assessments, any assessments which we are taking as class assessment like this, will sometimes this a part of revision you may say, but we'll have these assessments like this, and whatever score that will be reflected in your internal assessment, that will be sent to the university. But also just judge yourself. You have to sit after roughly 6.5 months maximum, no, like 6.5 months, maximum 7 months for the university exam. So if somebody, if you can't say about these parts of a stomach, phases of a action potential, what is the difference between resting maintenance potential, or is it same in all cells? No. So what are the values in different cells? Or simple things like about percussion. Some people can't define palpation. Then what will you do after 6 months? In 6 months you have to cover another more than half, more than almost 2/3 of the syllabus, not only in physiology. In anatomy, still left to discuss, even if the abdomen is being discussed after this head, neck, brain, the most, that means there will be so many things there. Physiology also, CNS. Biochemistry syllabus has been shortened a little bit after this new competencies in the year 2024, but still there are to memorize so many things. So almost 50 people are appearing. Some I think passed during the review process of the theoretical examination. Almost 60, 70, 60, more than 60 failed in physiology itself, or like 56 or 57. In anatomy and biochemistry, the figure was more than 70 in each. So just know about these things. That is not to demotivate you, but you have to think what you will have to do. Especially in this year, so many 10, 15, 20 people have joined. 10, 15 people have joined very late in January. Almost after 3 months the course was started, and some have joined 1 month. Many have joined 1 month after the course was started. So you are getting less time, but you have to cope up and sit for the exam. So what we could have done is, we should have done rather, we should have, as a clinical physiology revision class, we can just go to the clinical room and practice this. Yes, that is how to approach a clinical physiology class, because you have to perform. Nobody will ask you like this, what is percussion, what is palpation. You have to just perform, and relevance related to that the examiner will ask you, but the clinical physiology you have to perform. So, but again I am telling, in 1 hour, 2 hours, maybe 3 hours in 3 classes, respiratory CVS exam, you do once and you forget, you will obviously forget. It cannot happen like that. You have just learned it, respiratory, and so after 10 days you will have to, so now 10 days. Now after in that time again abdomen will be covered. So you have to again practice those at your hostels, homes, wherever. Better in hostels to make groups and practice. Otherwise you can't perform during the exam. And some things we ask theoretical today also, so you just note. Very simple things will be asked in exam. First there will be basic questions, but even if you can't answer that, then the examiner won't go to, so the examiner won't pass you. Straight away they won't pass you if you can't answer like what is action potential, what are the phases. If somebody says calcium in action potential, can't name the muscle proteins. Very bad. Neuromuscular physiology will be completed day after tomorrow in your theory class, and we'll start with hormones next week. Endocrine physiology, still endocrine is left, reproductive is left, respiratory is left, renal is left, whole of nervous system is left, integrated physiology is left. We'll cover those along with some topics we'll go on covering, like with pancreatic hormones, we'll be covering obesity and metabolic syndrome. They are, and obesity, metabolic syndrome, earlier it was taught in medicine, so they have given it as a part of integrated physiology. So we'll cover it together. Maybe after cardiovascular and respiratory is done, along with cardiovascular and respiratory changes during exercise, that will be taught. Although some basic changes you have learned in the practical class. So we could have asked today also. Changes in posture, exercise, what happens in blood pressure. So some other details are there which have to be studied. So what we will do after that, almost 2/3 of the syllabus has to be covered still in 5 months. In 4.5 months, it will be covered, and you have to sit for the exam by 6.5, another 2 months. Because one part of that 2 months is the internal assessment, at least one more internal assessment mandated by the NMCs in universities, the regulations, university. At least 2 internal assessments we have to show that this has been taken, theory as well as practical viva, and average of those marks, plus what we do is this continuous assessments, we put the average, we do the average. So if your performance is so poor, it will be affected. The university will not even consider you eligible. And if it is still due to exam, if the institution can arrange some more exams, if you are not considered eligible, then again after 3-4 months, if there is another exam, so if it is about less marks, less score, then maybe another exam, that is up to the institution, whether they will arrange so that you pass there and again the average increases and you can be sent for 3 months later. But if it is about the attendance, then nothing to do. Maybe other arrangements have to be made, because you cannot be allowed to attend all people if it is say 60 people, 70 people for attendance. So with the other batch, and arranging extra classes won't be possible. So maybe you have to arrange classes wholly separately and sit after 1 year if it is about the attendance, if you are not allowed due to the attendance. So be careful. What else can I say? On Monday, maybe you will be starting clinical examination of the abdomen, and go on practicing this, otherwise you will forget. Respiratory study, use your books and make groups. Don't always make the same groups, that is my advice. Sometimes interchange groups, so some mistakes will come out when 2 or 3 people doing the same mistakes. So interchange groups in the hostels and go on practicing. Otherwise clinical physiology won't be possible.